When I'm behind somebody slow, just sing that tune in my head, and it kind of takes me to a happy place, as Jordan says on Celebrity. Right, sorry.
Like an earworm. Well, welcome back, everybody. Another Friday night shenanigans with us lot. Joining us on the panel, we have the fantastic Will Murphy, and we have the wonderful Carl Horton. Guys, how are you?
Very good, very good. How are you?
Thank you.
Fantastic. Will, so how did last weekend go?
Yeah, it was really good. I'm just sort of conscious now that I was sort of bleating away about how hard my life was from, having a full week's work and then having to run a course, not run a course, be on a course, sit at the back of a lecture theatre playing Candy Crush and, talking a bit of dentistry now and again. So, do you know what? It was good, actually. It wasn't the last one, because we've got one more, which is in Birmingham, in Edgbaston, and that'll be it. Yeah. So some of the cohort were taking their exams today and yesterday.
Sorry about the noise. Recycling's I hope the recycling's going out, or we're getting broken into, one or the other. If the signal goes donk, then my laptop's been nicked.
Okay.
We'll watch out for Midlands today just to see if.
Sorry, Will. Carry on.
No, that was it, really. Yeah, just good course, all on soft tissue and that kind of thing, and everybody seemed to enjoy it, and it was all good. And then it was straight into the next week, which has been really good. Very busy. So on a bit of a sinus graft roll at the moment. Seems to be a bit of a sinus graft shop going on. So good, interesting stuff. Very enjoyable.
Good.
And lots of cases in the pipeline, so that's good.
Excellent.
That's good. And you're finding the workload a bit easier now, Will? Not having to have an afternoon nap between morning and afternoon sessions?
I'm fine now. Come home.
Fabulous.
6 o'clock, straight to bed in my Horlicks. Slippers on.
Crikey, we better speed this up then.
You know what it's like at my age.
Carl, what about your week?
Younger than me? Yeah, I'm old now. I had a birthday on Sunday.
Oh yeah.
How
was
that? Lovely. Quiet, obviously. So great. No visitors. Get in.
We're grumpy old men now.
I can see. We're going to change the name of this panel. I can see it.
Grumpy old men.
Yeah. Okay. I was a grumpy young man, so it's not made much difference, really. Yeah. Just grumpy, like one of the seven dwarfs.
You look good for 60, though, Carl. Fair play.
Cheers, thanks. It's all the alcohol, so it's just preserved everything.
What did you do Monday? Do
you know, I was a little bit nervous about that. But that was the webinar with the three oral surgeons and the wonderful Joss, and yourself, obviously hosting, and then me
well done.
In the background. So unfortunately, I couldn't see it. So I could nip in now and again, but I was looking after the chat and just making sure that everybody was okay and it was working all right. But yeah, I was a bit nervous about it for some reason.
How many did you have on?
As in the audience, we had 90 at one point. We had 240 register. We had 400 people click and look at it.
Yeah,
and then on the replays, I haven't looked at the replays, but there was about I think there was about 100 and something watching on the replays. So yeah, probably close to about 200, but not live, not watching it live. Wow, no. In and out.
Yeah, it looked good. I was trying to multitask a little bit because the guys who were sitting their exams, I was trying to do I was doing sort of Zoom vivering for them.
Oh.
Giving them a little practice, but yeah. So I had all the screens going. It's like mission.
Check you out, blimey!
Even at my age.
Yeah.
Candy Crush on one webinar.
Yeah.
So again,
as long as it raised some awareness. No, I was going to say, regardless of the numbers, just as long as that's reached out to somebody and
I think they're fantastic anyway with what they do. But they all four of them were just superb. From the little snippets that I saw, I know there were a few hiccups with St. John not being able to show his slides, and then I think he got cut off at a perfect point. I can't remember quite what he said.
It was.
And then I had to tune out and tune back in again. And so and just some of the cases, it kind of, when you do speak to those guys, and they kind of have a sense of calmness, and you kind of understand why, if they're dealing with that every week, day in, day out. It kind of makes our job look a little bit like, I get a bit stressed if I'm in the car sometimes. You kind of think, different level, isn't it? They're dealing with people's, that are in a different stage in their life every day. So it just probably gives you a different outlook on what you kind of complain about, I would imagine.
I think when
100%.
I see stuff like that, and from, again, sort of my short time at the QE, you just think, I need to calm down when I'm getting annoyed that my my membrane won't sit still over my firewall. Suddenly everything is very much in perspective.
Very much so. Very much so. Do you know what? It's funny Cole should say that, because literally just before the webinar, there were some issues, and it was obviously meant to start at 6:30, and it was 5:28, and we couldn't get the slides to load. And honestly, two of their slides, they were just calm. Inside, I'm going, ooh. But of course, look at the job they do. That is not going to faze them one bit. Bigger picture. But what humble people they are.
I know that I'm going to get ribbed for that. You do know I'm working on Saturday and Sunday, and I'm working specifically with St. John on Sunday. So I know that he's gonna give me some grief about that.
There'll
be some words said with myself in a very nice way, but I've got to put some armor on. I'll get a bit of flack for that.
Sure you will. The rest of your week?
Yeah, good. Surgery, like Will said. So, lots of cases, some big cases, sort of partway through those, learning a few little things, some of the new tools arrived. So, do you know, with all those little, what do you call them? Hand torque drivers. Right. So you can put the torque on them, and then, so that arrived. So I got a new one of those. I can tell you a funny story and a cautionary tale about when I was supervising somebody using one of those. Yeah. Well, briefly, yeah. No. It doesn't have to be brief.
Well, they were. Let's say they were below the sinus and hadn't quite gone to depth with their drilling, so he decided to use the torque driver to give it a bit more oomph, and then let's say the hand action was like this.
Really? Dear. That's the sound effects. That was perfect. I've got to gather that's probably Seb.
Yeah. Oh yeah.
Well, out of the ear and. Or under the eyeball. It was well and truly in the sinus. So there you go. That was an interesting day of mentoring.
Goodness, I would imagine it was.
I was getting all grumpy because I had to put my gloves on. Usually I like to hover around and stare out the window and that kind of thing. So
fantastic. Oh, right. Oh, goodness me. I bet they never use one of those again.
Needless to say, it all was fine in the end.
Of course it was.
Great.
Of course it was.
Great.
Oh, really does sound like murder.
Yeah.
Happy
it will be in a minute.
So are you finding, Will, I don't know about you, are you finding that you're picking up some of the larger cases a bit more than you were perhaps prior to lockdown?
Yeah, I think some of the ones for the people who are probably hesitating a little bit and putting off have resurfaced and again seem quite happy to move on and get these sorts of things done. So yeah, there is a mixed bag of stuff, but certainly people seem to, I don't know whether again because people aren't spending money on other things or going away, people are here and present and available. So, quite often people are thinking, it's my daughter's wedding here, or I'm flying to Australia there and I want to fit it in around there, and not quite sure if they're going to be, put out by the whole situation. So I guess it's kind of smoothed the path in some ways, hasn't it, for people having treatment? So that's my take on it.
I think it's almost focused a few people in a funny way. You know, if they are at home and all the homeschooling's been done and they're not at work, then their mind switches to themselves and treatment.
Why not get it done?
Yeah, we've certainly found that, haven't we? We've had
Yeah.
a large uptake on the large, day cases. So
Right through.
Yeah.
If you're thinking about your big implant treatment plans, don't hang about. Come on,
Get it
it's
done.
great.
absolutely. Well, COVID's having a break, so I mean, what better time to have your treatment?
Well, the 5 days, 5-day break.
Here we go. Are we all?
Best not.
Are we all tier 3s? Is there any?
I think we are. I don't think.
Yeah, I'm not yet.
You tier 2? Are you out in the
Tier 2? Yeah, I'm out with the
out in the posh bit of the Midlands?
Oh, I don't know if I'd say posh, but I'm there.
What
Let anybody in.
Do you know what? Because I have a sad life and I've got no social life. Got no. You two are my friends.
Oh.
The virtual.
Did he pay you enough?
Yeah.
Will he pay me £20?
You're gonna start charging me more, aren't you? But I don't really. I've got to be honest. I don't listen to the news much anyway.
I wouldn't.
And okay. And because I forget things. I got told off in Aldi because I went to pick up some stuff from the post office. Parked in Aldi car park because it's near. Thought, well, I want to grab some little things. So nipped in, bought some little bits from Aldi, got in the queue, mask on. So used to wearing a mask, and slightly daydreaming. Was stood on the little spot, but the spots are 1 meter apart, not 2 meters apart. So I guess they got put down at the beginning. And the person in front of me, because I kind of stepped off it slightly, do you mind? Can you step back, please? I mean, really quite aggressively. And of course, I just kind of went, yeah, sorry, I was just daydreaming. Whatever.
You're in with the officious queuers. They have a clipboard and a high-vis vest or something.
And one of those tech
It was one of the other shoppers. It wasn't the staff. I don't think the staff cared less.
Yeah, no. Well, you'll get people like that anyway, like the tutters.
Oh,
yeah.
Who carry a 1 meter rule around with them.
Yeah.
And
do you know what? Maybe there's a gadget to be sold there. Like these little laser markers that you used to get.
Yeah.
So you could just kind of have one facing forward, one on each side, and one on the back, and it just kicks off if anybody gets within a meter of you.
Well, even better if somebody, could have a little electric shock on the back, perhaps, for those that feel that they,
Cattle prod, yeah.
Even better.
But anyway,
branding.
I'm getting sidetracked. I actually don't know what tier 3 means now. Is there a new rules? Can clubs open up? Can restaurants open up?
There's a very good joke out there for tier 1, tier 2, and tier 3, and it's something like tier 1 is chips, tier 2 is chips and a pint, and tier 3 it's no pint. I think can't remember.
Yeah,
it was a very good one.
Yeah. So I think you can have a beer with a substantial meal.
Okay.
In tier 2.
I think it's 2. I'm not sure.
See, brilliant. You've confirmed my point exactly.
I've got it nailed.
Yeah.
So it's go to work, don't go to work. You don't have to go to work. Eat out to help out.
Yeah.
Stay in.
Yeah.
You're sorted. I listened to you, Will. Right from the beginning, we should have listened to you.
Get with it, guys. Get with it.
Well, we've got these 5 days at Christmas, and I was watching, I can't remember what it was that was on last night, and one of the comedians was saying, well, 5 days is too much. We only need 1 day, because that means that gives you got 5 days now of your in-laws coming over.
I know. 1 day was brilliant. 5 days, really?
Yeah, 5 days. I mean, how much do they not like the general public? 5 days. No. Sorry if you're listening, by the way.
So when you guys are in your different practices, how are all the general dentists doing? What's the vibe amongst them?
Certainly one last Friday. Yeah.
So go on.
Friday. Last Fridays, for example.
Ben.
Yes, I wasn't going to say.
Ben's on a different level altogether. A very, and he won't mind saying it, special level.
A very special level.
3'5". So he's quite tiny, by the way, Will. Ben.
He's great. I would say pretty level-headed, most of them, as in, let's just get on with things. I don't think there's maybe one or two that are still a bit more precious on.
Are they all private practices you work at?
There's a couple of mixed.
There's a couple of mixed.
So in the mixed practices, or the mainly NHS practices, are they with the 80-20 rule? So I think
I know what you
mean. Which is, for the uninitiated, that NHS payments are 80% of payment for doing 20% of the work.
Yeah, that's a good question, and I think that it's difficult to answer that, because it's not something that. Well, what they've tried to do is they've tried to look after as many patients as they possibly can that have needed the work on the NHS side of it. So in other words, they've stuck to the rules and the regulations, the SOPs that have been passed down from the CDO, and followed those guidelines. So where the work has been urgent or necessary, they've focused on that. They've reduced the number of AGPs. So in other words, if it's something that's going to involve an AGP, but they can manage something a little simpler. So, avoiding a crown prep, maybe a little bit of, and I'm speaking slightly out of term because this is just a few conversations with a couple of dentists. They're kind of patching, holding things over until they can then start to return to a more efficient level of working, but not to the detriment of the patients, obviously. But they're struggling. So some of them are struggling on the NHS side of it, to look after the patients.
And is that because they don't have the facilities to deal with the fallow periods, or they don't have extra surgeries to move into?
Yeah, it's not just that, it's the staff as well. So
with this second lockdown, some of the practices have had to just reduce the staff level again to minimal staff. Therefore, they can't process as many patients again. And unfortunately, it's been tough, I think, for one of the practices. I don't know if it's because patients are getting impatient or frustrated themselves, and of course being told that those appointments are limited again. Like the practice I'm on about, Carl, they said last week they've had a really tough time with quite a few patients. So,
and why have they reduced the numbers of staff?
It is a big practice, isn't it? The one that we're talking about.
Yeah, it's not that they've reduced the number of staff; it's the staff that are not able to come into work for various reasons. So some of them might be ill, some of them might have childcare issues, whereas before they hadn't got those issues because the family support was there. Now they can't use that family network because of the lockdown issues. So it has a huge knock-on effect in how the healthcare can be delivered, because if you haven't got anybody on reception, you can't have anybody coming into the building. So the managers are stepping up and working on reception. But you can't have anybody that's on reception or in management being a nurse. So if you haven't got a nurse, you haven't got a nurse.
Yeah, they are trying very, very hard. I have got to say, this practice in particular. I mean, they are trying to get through the patients, if that makes sense. It's just not as quick as they would like, and quite clearly not as quick as the patients would like as well. But hopefully next week things will change again, and they can get back to, childcare being in place and nurses being able to come back. It's a massive knock-on effect, isn't it? Like Carl said, it's a ripple. It is.
Yeah.
Big effect.
Can you hear my son?
Yes.
I do apologise.
What's he doing?
I've got no idea. It'd be Fortnite.
Is he unhappy about something?
No, I don't think so. I think
gaming.
I think he's quite happy about something. I think he's calling me.
Has he usually got like a phone link onto friends who are also playing?
Yeah.
That's what Jack does. he's usually got the iPad propped up and FaceTiming with his mate.
Yes.
Also playing.
I get that with my 9-year-old twins, and they go, "Can we borrow your phone so that we can FaceTime while we're on?" I'm like that.
Yeah. Jack,
I used to have a Game Boy.
right in the demographic of all that.
But your patients, Will. I mean, I've asked you this really since we've started the webinar, and I mean, or webinars, and you've always come back with good feedback with your group of patients, and they're still, patient, particularly.
Yeah, I mean, I think we've really gone hammer and tongs. It's not the best phrase to use for a dental practice, is it? Since we were allowed back in, if you like. So it was kind of sorting out all the mess and more besides. So we've by spacing ourselves out and each the dentist having 2 surgeries to work from, I'm pretty happy that we've really made it work well.
Yeah.
So if people need treatment, they're getting treatment. Nothing's really off the table as far as we're concerned. Plus, like I said before, we get a good intake of emergency patients coming in as well, and that's in both sites. That's in Norwich practice as well. I know Emma's been sort of particularly busy with a lot of new patients coming in, just needing standard dentistry, and actually signed up quite a few Denplan patients as a result of that as well. So,
that's great news.
Good. That is good news, isn't it?
Yeah.
It's isn't it funny how with the new processes, which we did say right at the beginning when we started these webinars, how we said that we would adapt very quickly, and isn't it funny how we have? When you look
on one of the other podcasts that we had where we were talking about sort of corporate dentistry and smaller private practices, and one of the things I quite like about smaller practices, although there's many benefits of a large setup, is that you do get autonomy and you're able to move pretty quickly to change things or adapt. So I think it does probably in times like this mean that things happen a little bit quicker because we can make them happen a lot quicker.
Absolutely. You're not waiting for the say-so, are you, or the nod or another policy to
well,
I agree.
That management tier, isn't there? Isn't that a bureaucracy of
of course.
ding 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 ding.
It's just El Capitan with general hat on.
Yeah.
Absolutely.
Yeah. So I think that really it's been the checkups really. The checkups seem to have just been delayed. But treatment wise, I don't think they've had any issues that we've talked about. That's the kind of the non-corporate ones. The corporate ones, do you know what? I couldn't tell you what goes on with some of those guys because it seems to change every time I turn up. We can do this, we can't do that, we can do this. I think the one over in Wales, they had some new instructions which were that they had to focus again on emergency care, and it had to prioritize like that. Not that it shouldn't, but if you know what I mean, you'd slot your emergency patients throughout the day, whereas now it's emergency care that's absolutely necessary, and then the next care, and then checkups come right down at the bottom. So anybody that needs a checkup goes right to the back of the list, and anybody that comes in and has a checkup and then needs care, right to the top of the list. Which is, I guess, a slightly different way of managing it, really.
But your checkups and this is your goodwill.
Yeah, exactly.
That's your value of your business, is the people, the repeat business that may not need the fancy treatment but will be there.
Yeah.
Every 6 months, whatever, will tell people about you. One of the interesting things is when people leave a practice and come and they join ours, or as they have been doing, the biggest complaint that they always have is that they very rarely see the same dentist each time they go, and that's a big bugbear for a lot of people. There's that sense of trust that has to be earned, possibly over a period of time. It's that intimate relationship where you lie back and you're vulnerable and all the rest of it, and that can take a little bit of time to to work itself out. And then if you've just got somebody totally different, somebody who you may gel with, you may not gel with the next time, and you don't quite know who you're going to see, who like we've said before, we sometimes know our patients' children or the name of their dog or what their hobbies are, and that's how the narrative starts, with each appointment.
Of course it is. We had that echoed, I think, twice, certainly on Wednesday, with a couple of the patients when they've been referred in and there's no referral information. We said, so who's your dentist? And they've gone, and you think, oh, and they said, well, last time I saw so-and-so, and then I saw 2 before that, and you're like, oh, okay. They say we never see the same person twice, and it's like,
yeah.
And you're right, you do build up that rapport. You do, whether you like the dentist or you don't, going to the dentist.
We're geared in that way, aren't we? That's human nature. I think, you build that trust up, and then the person you trust is who you stay with. And I remember a hairdresser, not that I use a hairdresser, Will, probably you don't either, maybe. Not sure. In your case, it might be massage parlour. Did I just say that?
I get Nicky Clark himself to do mine.
Do you really? I get Tony Orguy.
A little bit of polish.
Yeah.
Shine it up, and then we're good to go.
Still can't believe you just said that, Cole Horton. Will Murphy is not like that.
I don't think he heard.
That you're frequenting massage parlours, Will Murphy. Only on a Sunday, not a Friday.
Right to come out with
But it's the same with other things as well, isn't it? Same with your car. You find a garage that you trust to look after your car. It's I think we do it with all sorts of things.
Well, you do, don't you? Doctors and all sorts.
Yeah. Well, most things, maybe. Shut up, mate.
If I don't get the same masseuse each time, then I'm.
I had a feeling how Friday might go this week.
We need to stop this now.
Yeah.
Yes, we do.
There's a phrase that almost came out of my mouth, which I'm just going to.
Oh, please don't. Well, we're on countdown, boys. We're on countdown. Nearly 7:15. Carl, what I wanted to ask was, obviously you said when we began earlier that you're doing similar, the same as what Will did last week. So over this weekend, what's different about tomorrow? I know what's different about tomorrow, what you're doing. Obviously,
Case presentations.
Yes. So how is that being done tomorrow?
So rather than being face-to-face, we're doing it online. So the poor souls have to present their cases, their implant cases, to all of us. So we're all watching like that, and they have to go through their presentation, and I will be very gentle and kind and soothing, and I will congratulate them on how well they've presented the case. And
be mean and pick holes in everything.
Yeah. Absolutely.
Can I ask you two? You both spoke about obviously doing these, not just these kind, but the assessments online and Zoom. Do you think that it sounds daft, but do you think they would get more nervous doing it that way to you guys? Because not being funny, it's focused. Like I've just got you two in front of me, and that's all I can see. Whereas if I was in a room doing that, you're not so. I don't know, it almost feel pressured, like you're both just looking at me. So if I was doing my presentation, do you think a lot of people get nervous for that reason? Stop smirking, Will Murphy.
I think it's different. I think that it's individual. I think some individuals are absolutely fine presenting. I think some individuals are just kind of like, and then other people are extremely nervous, whether it's online or whether it's face-to-face. I don't necessarily think I think you can almost hide sometimes online a little bit. Okay. And I won't say when it was, but during some of the online lectures that I've been a part of, when a question's been asked, the person that answered the question answered it so well and read it out like it was written down on the screen, like Yeah.
Right like this.
Yeah. But you know what?
Oh yeah, it's the posterior superior alveolar artery.
It was a little bit like that. But you know what? I hadn't got an issue with it because I thought, well, you've actually gone to the effort to actually figure out the answer. So I'm not, well done for reading out, but
you're not doing your final exams like that, are you?
No. It's case presentations towards the final exam, so they're not marked. I'm just going through and kind of we're just having a look and see how they are, refine them, talk about what should be included if it's not included, the good things, the bad things, and just get them into the used to presenting cases. And then Sunday is the advanced cadaver course, so that's been running today. They had the lectures today. Then tomorrow they'll be doing the suturing and the flap design, the simple grafting, and then Sunday, which is the day that I'm involved in, is the block grafting, sinus lifts, and nerve repositioning. Not that I advocate repositioning nerves, but if you want to,
every Monday morning,
yeah, just pop it. Yeah.
So really, if I was one of the delegates tomorrow, I suppose I know there's that thing of who's going first. I think I'd want to go first because you guys, I know, can sit down and have to observe over 10 people. So I think I'd want to go first. Don't think I'd want you after sitting there for 10 cases.
Yeah. I was always, well, funny enough, that was always my approach, was just get it out of the way, over and done with. And then I could sit back and relax, really, maybe as a student. I shouldn't say that, should I? But yeah, so that's just, I don't know whether you were the same, Will, when it came to the cases. Just
yeah, I am. I think when I was doing it, and I think I probably would prefer doing it on a screen in terms of nerves, because it went down to London, waiting for my slot, which I think was like in the afternoon, so I could see the people who were coming out like, yes, finished, and I think, oh no. And I was sitting in the Cafe Nero across the road from the Royal College and thinking of all these things that I didn't know, and trying to look at the formula for what's in anesthetics and stuff, just all these last minute things that I was just messing my head up with. Whereas I think if you're like, first of all, if you are the first one, just get in, get it done, get out. But also, I guess, in your own home environment where you can have your shirt on and a pair of shorts and your flip flops, under the table.
Yes.
Maybe a bit more.
There's a lot to be said for that, actually. Yeah.
Yeah, but the rehearsals was good. I did with some of my guys, because you almost need to get in the flow of answering questions without starting from the very beginning. I'm kind of like, listen to what they're asking. They're kind of hinting, they're leading you in there. So just, pick up on that and try and give a succinct answer, or just keep talking until you get told to stop, which is a good thing. There you go. Viva hints for anybody out there.
Yeah. Well, gentlemen, we've hit 10 to 7. Where's that gone?
Wow.
Where's that gone? It's flown by.
Flown
it's
again,
flown. Can I just say something really quickly on 2 levels? I want to say I've really been enjoying doing all these, guys, and we've had some fantastic feedback. And do you know what? The 3 of us never really probably say much to each other about this. We just schedule it in our diary. Will knows. We sort out the speakers and who's on the panel, and we just turn up and we do it. And then Carl obviously sorts it all out. So I want to say thank you both. I really do.
Oh.
And honestly, the feedback has been brilliant. There are people, and Carl knows because I've mentioned them, non-dental people that tune in and watch this every week. Yeah. So I want to say a massive thank you, honestly, guys. It couldn't be with 2 nice people doing it. It really
glue that holds it all together, Kate.
Yeah. Oh well, thank you very much.
Massage parlor,
the stick that.
Yeah.
But, well, that could be the name of the massage parlor, Boston. Anyway.
Cuddles.
Oh, stop it. And just the other thing I want to say to anybody out there, please, if
I do have a little story, actually.
let me say this first.
One. But we had a few patients come in when I was at Bearwood, and They were from Eastern European descent, and a big guy would come in with them and say, "Can you sort their teeth out?" And it was, sometimes just straightforward scan and polish. Sometimes it might be the odd veneer and crown. Anyway, there was, if you remember, Will, there was a raid on one of the massage parlors in Bearwood, and they had it on TV. You probably don't remember. You might have been in there. I don't know.
I was going to say, did you recognise me?
Yeah. Well, no, but what I did recognise were 3 of the smiles that walked out. So,
those are my veneers.
That's where they work. Yeah. Oh, that's awful work. Anyway,
okay.
Sorry, I've digressed.
No, not at all. I just wanted to say to anybody out there that's listening, if you've got £1, £2, £3, £4, £5, anything, if you would consider please donating it to the charity, the Oral Mouth Cancer charity, you can hop on our website and you'd find a link there. Anything, please, anything. It makes a massive difference.
It does. Thank you.
Also,
thank you very much, Kate.
No problem. Guys, it's been good. Hope it's a good weekend for you both, Carl. I know it's going to be a busy one. Go easy on them. Go easy on them.
Yeah, don't be Mr. Nasty. Be the nice guy for once.
And I hope you have a lovely weekend, Mr. Murphy. And
Cheers,
we'll see you next week.
Yeah, thank you. Cheers.
Take care, guys.
Bye, everybody. Bye-bye.